California, like the rest of the nation, is grappling with a serious healthcare dilemma: how to use opioid medication to relieve pain safely and effectively, while at the same time reducing the risk of prescription medication misuse, addiction, and overdose. As an emergency room physician, I saw the impact of opioid abuse has on families, and I believe we need to reduce the availability of prescription medications that may be misused or diverted. Last year, I authored legislation to establish partial fill prescriptions, which the governor signed into law. Allowing for a partial fill provides patients with confidence that should their pain continue beyond the expected duration, they would be able to access appropriate pain relief without unnecessary delay or cost. Conversely, should the patient only require the lowest dosage at the shortest duration, it will help reduce the supply of unused medication available for misuse or diversion. This year, I am authoring AB 2384, legislation that will place a 7-day mandatory limit on the initial filling of those prescription opioids that have the highest potential for abuse. This will help to ensure that patients are able to continue the appropriate course of treatment if needed, and also to have a choice not to fill the balance if unnecessary.
I'm here today representing the thousands of victims of opioid abuse in California and the families that have suffered throughout the consequences of this terrible epidemic that's far-reaching. Years ago, I'm also the father of 2 children, my 10-year-old son Troy and my 7-year-old daughter, who were run over and killed by a doctor shopper of narcotics who was abusing and doctor shopping to numerous doctors getting medication, and drove off the road and ran them over when we were, as a family, out for a walk.
AB 2384 will also continue to advance California in the direction of recovery as it removes barriers to some of the most effective and innovative treatment of substance abuse disorder and medication-assisted therapy. California is one of the states leading the country in reducing overdose deaths from prescription opioids, and now we have a chance to lead in providing critical recovery services as well. With these measures, I hope we are able to reduce the misuse of opioids while also effectively relieving pain.